During this small lesson, we're going to talk about dissociative disorders. Among the most bewildering disorders are these dissociative disorders. The person's conscious awareness is said to become separated or dissociated from painful memories, thoughts, and feelings. So, in this state, people may suddenly lose their memory or change their identity. Often, this is in response to an overwhelmingly stressful or traumatic situation. So hopefully in the course of this lesson, you will be able to learn the following. What are dissociative disorders and why are they controversial? What characteristics are typical of personality disorders? And what biological and physiological factors are associated with antisocial personality disorder? So first off, we're going to talk about dissociative amnesia. This is basically characterized by a blocking out of critical personal information or experiences, usually because of a traumatic or stressful event. And this could be something that's very, very traumatic and stressful. And so oftentimes, for example, with abuse and molestation, children often can't remember it. It's been blocked out of their memory. Sometimes this can be so severe that they forget personal information such as where they live or who they are. So this is an example of dissociative amnesia, and this also is an example of how dissociative disorders can be so controversial. As you watch this clip, I'd like you to think about why these disorders can be so controversial.
This month, the man who had accused Cardinal Joseph Bernardine of sexually abusing him 17 years earlier withdrew the charges, questioning the therapy he had received.
Based on information I have learned since filing the lawsuit, I now realize that the memories which arose during and after the hypnosis are unreliable. In fact, if I knew at the time I filed the lawsuit what I know today, I would have never included Cardinal Bernardine in it.
But not all repressed and recovered memories can be discounted. Former Catholic priest James Porter pled guilty after dozens of his victims came forward with accusations of sexual abuse. For many of them, the memories of abuse returned after lying dormant for almost 30 years.
All of a sudden, it came back to me. I started having very bad nightmares about being raped and about running and being on the roof and kicking this man over and doing all kinds of things. And to think that they let a priest do this, and it really got to me. It really did.
There have been cases where the process to recover memory has led to disaster. At 32, Laura Paisley thought treatment for an eating disorder, but says that over a period of 4 years, her therapist convinced her she'd been molested and abused by her entire family.
He used hypnosis, trance riding, relaxation, age regression, rage therapy. I used to throw clay balls into the wall and scream. And the hardest part of it was when I realized all of the flashbacks were not reality, and I had lost all those years.
Laura eventually sued her therapist, settled out of court, and has since been reunited with her family.
So, some of the things that are controversial about dissociative disorders is trying to really figure out if these memories are true memories. They can actually be concocted by the person, or it actually can be something that is influenced by the therapist. Okay, so we're going to talk now about dissociative fugue. So this is when an individual will suddenly travel away from work or home and they're unable to remember the past. In some cases, these people will all of a sudden, because of a traumatic or stressful experience or a series of experiences, just kind of walk away. They'll forget who they are, where they're from, and this is in order to try to emotionally separate themselves from the trauma, but also physically separate themselves from the trauma. And some of these people have been found about thousands of miles away from home. They sometimes create a new identity altogether. And often it can happen just for a few hours, it can happen for a few days, it can happen for a few months. So the next thing we're going to be talking about is dissociative identity disorder. So dissociation itself is not so rare. Now and again, any one of us may have a fleeting sense of being unreal, of being separated from our body, or watching ourselves as if in a movie. But a massive disassociation from ourselves from an ordinary conscious will occur in things like this dissociative identity disorder, often known as DID. Okay, so basically, this is a very controversial and rare disorder in which a person is going to exhibit two or more distinct alternating personality. It used to be called multiple personality disorder. So at different times, there are going to be two or more distinct personalities. They seem to control the person's behavior, each with its own voice and own mannerisms. And so the person may be prim and proper at one moment and loud and flirtatious the next. Typically, the original personality denies any awareness of the others. Now, there are skeptics to this. So the skeptics, they question the genuineness of dissociation identity disorder. First, they find that it's suspicious that it has such a short history between 1930 and 1960. The number of DID diagnoses in North America was about 2 per decade. In the 1980s, when the DSM-5 contained the first formal code for this disorder, the number of reported cases had exploded to more than 20,000. Also, second, the skeptics noted that DID is much less common outside North America. Although in other cultures, some people are said to be possessed by alien spirit. Also, another thing is, instead of being a real disorder, some ask, could DID be an extension of the way we vary the selves that we present? As when we display a goofy or a loud self while hanging out with friends and a subdued, respectful self around grandparents? If so, say the critics, clinicians who discover multiple personalities may merely have triggered role-playing by fantasy-prone people. So these are the major arguments against it. Also, another argument against this disorder, a lot just wonder if it is a real disorder, how can we understand it? So, both the psychodynamic and the learning perspective interpret DID symptoms as ways of dealing with anxiety. Psychoanalysis see them as defense against the anxiety it's caused by, like an unacceptable impulse. So, in this view, an immoral second personality allows a discharge or letting go of forbidden impulses. Other psychologists also say that dissociative disorders they put it under the umbrella of post-traumatic stress disorder. So in this view, dissociative identity disorder would be a natural protective response to traumatic experiences. It's a way to protect ourselves from trauma. It's a way to escape the trauma. So the debate is going to continue. On one side, there are those who believe that multiple personalities are the desperate forms of people trying to detach from a horrific existence. And on the other side are the skeptics who think that dissociative identity disorder is a condition that's constructed out of the therapist-patient interaction and acted out by fantasy-prone, emotionally vulnerable people. Okay, so personality disorders. So personality disorders, there's a little debate about the reality of personality disorders. These disruptive, inflexible, and enduring behavioral patterns interfere with a person's social functioning. Some people with these disorders withdraw and avoid social contact, and some interact but that do so without responding emotionally at all. Others will show insecurity, instability as they manipulate others or pull them close, and then they'll push them away. So the most troubling and heavily researched personality disorder is the antisocial personality disorder. A person with this disorder is typically a male who shows no conscience in his actions, or even toward friends and family. When an antisocial personality combines a keen intelligence with no conscience, the result can be charming and clever con artists, but even a fearless, focused, ruthless soldier, CEO, or politician. The lack of consciousness usually becomes plain before the age of 15. As the person begins to lie, steal, fight, display unrestrained sexual behavior. Not all children like this become antisocial adults. Those who do, which is about half of them, will generally be unable to keep a job. They'll be irresponsible as a spouse and parent, and violent or otherwise a criminal. So this is important to understand. We want to try to avoid this disorder, and so we need to figure out what are the factors that are associated with antisocial personality disorder. Okay, so scientists can identify brain activity differences in antisocial criminals. They have shown emotionally evocative photographs, such as a man holding a knife to a woman's throat. They display a lower than normal heart rate and perspiration responses. They have less brain activity in the brain areas that will typically respond to emotional stimuli. They also display a hyper-reactive dopamine reward system, and so this is going to predispose their impulse drive to do something rewarding, despite the consequences even. So one study compared the PET scans of about 41 murderers' brains with those of people with similar age and sex. The murderers' frontal lobes, this is an area that helps control impulses, they displayed reduced activity. Now this reduction was especially really clear in those who murdered impulsively. That means just they murder without thinking and without any kind of regard. In a follow-up study, the researchers found that violent repeat offenders had 11% less frontal lobe tissue than normal. So this helps explain another finding. People with antisocial personality disorder fall far below the normal aspects in thinking, such as planning, organization, and inhibition. These are all frontal lobe functions. So this all kind of reminds us that this kind of data reminds us that everything that is psychological is also biological. So they produce an overabundance of dopamine that creates a drive to do things despite the consequences, and their frontal lobes, which control impulses and planning, are less active, and in violent repeat criminals, they are about 11% smaller.